you may not be knowing the word Garbhsanskar. Garbha is the womb and the sanskar is the educating the child in the womb itself. And what is the, so we are basically talking, we'll be talking on the three-dimensional antenatal care. That is the care during pregnancy, the background research and how it is implemented by Brahma Kumaris across India, journey so far and way forward. So why the Garbhsanskar is needed, so we all know the facts, the problems, our maternal undernutrition, the maternal anemia, these are the global challenges we are facing. And this is the Indian scenario, the 57% mothers are anemic and then almost 21% suffer with the hypertension. So that was the maternal issue. We have the problems in the neonatal age group, the preterm, the complications, almost 16% results into the neonatal death, somewhere the problem during children, the age group of less than 5. And the scientific research has found that the excessive stress during pregnancy to be associated with all this. So why Garbhsanskar? Because we are talking about the problems in the neonatal age group, we are talking about the problem in the children or maybe in the adolescent, but then it starts right from when the baby is in the womb itself. And that's why we have the increased risk of the premature deliveries, low birth weight babies, the IUGR, the preeclampsia, everything is increasing. In fact, we face this problem in the adolescent age group, also the physically, mentally affected, the IUGR, the babies with the lack of values. So the science has evidence that the fetus in the womb can perceive and react to the maternal environment, environmental influence, and thus has an effect on the development of the fetus. If the maternal environment is so stressful, then definitely baby in the womb is going to be affected. And whatever happens during those 1,000 days of life, and the 1,000 days come from the intrauterine life, 9 months, that is 280 days, and post-delivery 2 years, 365 plus 365. So whatever happens during those 1,000 days affects and the influence on the overall health, right from the children to the adolescent and the the later life. That is why we say it's a fatal origin of adult life. The number of chronic diseases, we have the NCD department, because the amount of the burden of insulin health, insulin dependent diabetes, mellitus, hypertension, coronary artery disease, everything is going, it's alarming rise, but then it originates in the fetal life itself. So we have to, if we want to talking about the prevention should start right from in the womb itself. Slides. So that's where we have to focus on the, about the antenatal program. And we'll have to go back. Just okay. So I was talking about the fetal origin of adult diseases. So what we know is the stress begins from the womb and it goes, to the tomb. So we have to take care. So our project basically to reduces the incidence of the maternal problem, the maternal morbidity, neonatal problem, neonatal morbidity, as well as mortality. The project helps the expectant mothers to create a virtuous child. And through this novel project, in fact, we create an awareness about the saving the girl child also. The number of beneficiaries since start is almost 1,55,000 plus. Number of beneficiaries this year, online as well as offline, is around 5,000. So as I was talking about, the first 1,000 days of life is very important in person's life. So we need to focus and guide them during this first 1,000 days of life. It's about the three-dimensional antenatal care, because everybody knows it's a ANC. So it's a ANC visit, but it should not be a simple ANC visit. It should be three-dimensional antenatal care, wherein we'll be talking about the physical care, the mental care, and the emotional and spiritual care. So we focus on the balanced nutritional sattvic diet, the physical fitness, yoga exercise, because the incidence of cesarean section is also alarming. The normal delivery rate has gone down. So with physical exercises and yoga exercises, even the cesarean rate goes down. And the Raj Yoga meditation for the mental empowerment. So everybody knows about the diet and physical exercises, so I'll not be going into that. But then definitely Raj Yoga meditation, which is taught by the Brahma Kumaris, for the mental empowerment. So as we know, if we have the positive frame of mind, if the mothers are happy, we'll have the positive hormones release. So at the time of birth also, baby will be healthy and happy. As a child also will be healthy, happy, and as an adult also will be ever healthy, wealthy, and happy. But on the contrary, if there is the mothers are facing, the negative thoughts like the angry mother, depressed mothers, then definitely they will have negative hormones. Even the our genes are affected. The unhealthy genes get activated. Even our immunity system gets affected. So at the time of, because of the negative hormones, the adrenaline, non-adrenaline, corticosteroids, cortisol, what it will result into the decreased flow, blood flow, as well as oxygenation to the baby, will result into intrauterine growth retardation. It will have the oligohydramnios, and then the baby at the time of birth also suffers. Many of these children, we have to go ahead with the cesarean section. Sometimes they need, the ICU admissions, ventilatory support. So at the time of birth, baby is suffering. As a child, the baby is suffering. Even 2 years old child, we have to take them to the psychologists or the psychiatrist because they are suffering. And the psychiatrist says this has happened because the mother's mental condition at the time of pregnancy was like that. And as we have seen the fetal origin of adult diseases, so as an adult also they suffer. So what we have to do? Because the effect of negative thoughts, the thoughts of what anger, fear, ego, anxiety. Friends, thoughts are not just the vibrations in the air. They are very well defined electrochemical events which are converted into matter, which is converted into neuropeptides, which acts on the 50 to 60 trillion cells in the body. So the sympathetic dominance, increased stress hormone, it affects the maternal health, and it affects the baby at the time of birth, as a child and as an adult. So if we have some method, by which we are able to convert these negative hormones into positive hormones. So we'll have to convert the negative thoughts into positive thoughts. So if we have a thoughts, the positive thoughts like peace, love, happiness, bliss, purity, and then definitely we will have the decreased stress hormone, the maternal health, as well as the fetal health and the child health. As an adult will be able to take care. So at Brahma Kumaris, we talk about the Rajoga meditation, which helps the mother to experience the 7 innate virtues of the soul. And we all are basically souls. We run this body. So originally, everybody has this God-gifted 7 sanskaras. Everybody has these virtues. So those virtues are bliss, peace, love, power, knowledge, purity, and happiness. And with regular practice of the Raj Yoga, we basically bring about the positive shift in the attitude of the mother. And it is not only the mother. We tell every family member should do this. So it's the environmental change, because the family members are also practicing Raj Yoga meditation. And because of this, the positive impact of this on the mental and the physical health of the mother as well as baby. So basically, we get those 1,000 days time. It's a golden opportunity. If we, and everybody is willing to do, because everybody wants their child, physically and emotionally empowered. Everybody wants happy and healthy baby. So even the family members are also willing to practice this. So it is basically hypothesized that each virtue has, relation with the particular system of the body. Like the love, we know there is connection with the heart. If you are happy, you are loveful, then your heart will be empowered. Peace has the correlation with the respiratory system. So like those 7 values has the correlation, the connection with the particular system in the body. And that's why in fact, the baby in the womb itself will be physically healthy. He will be mentally healthy because he'll be empowered with all the 7 values. If the mother remains happy, irrespective of anything, if she doesn't become angry, so he will not have those sanskaras of anger. He will not have those sanskaras of fear. So this fear and anger, we need to take care that these are the biggest viruses which are causing more problem. So if the mother remains happy, mother remains peaceful, irrespective of the situation and the people's behavior. So we need to create awareness, because they are not aware how much their emotional health will affect the mental health of themselves as well as the baby in the womb. So if once we tell them, we can create the awareness, we train them, because it's a simple thing. We can meditate anywhere, we don't need some particular place to go and meditate. It is basically change in the thinking pattern. So and that is what I taught at the Brahma Kumaris. And we have done a lot of, research on this and presented in the national, international journals also, study of the antenatal care, the three-dimensional care, how it will reduce the pregnancy PIH, pregnancy-induced hypertension, IUGR, how we will be able deliveries at the term, and this was the pilot project and it is still ongoing. So which is showing that the preterm delivery rates decreases, the PIH, the incidence of PIH, incidence of the IUGR decreases, the incidence of cesarean rate decreases. And I'm sure with this three-dimensional antenatal care, we'll be able to take care of the developmental and behavioral problem in the children as the toddler as well as the adolescent, risk of developing depression later in so many children having depression, but the origin is in the womb itself, as well as the mental health problem in the mother herself later on, and the fetal origin of adult diseases will be able to take care. So what we do, we create a lot of awareness, we conduct a lot of awareness program, training programs, camps, webinars. So the online and offline awareness programs are conducted. We conduct, when we are doing offline programs, we definitely take care of the camps like free hemoglobin checkup, because as we've seen in the India, almost 57 maternal, anemia. And we create awareness about the diabetes screening also. We support the campaigns of the government. And so this is the vision and the mission of the Divine Garbhsanskar, as I've already discussed. And the mission is basically to the children of the today, they are the leaders of tomorrow. So therefore, the focus should be to lay a strong foundation when the baby is in the womb itself to build a healthy, happy future generation. And this is what we are doing daily online, because this we started in COVID. 15th August 2020 we started with this, and we 21 we started, and this is going on daily for last more than almost 1.5 years. So daily online session on the Zoom, so they can have a proper interactive session, and it is live stream on the YouTube also. So all these sessions are recorded and they are on the YouTube. We have created a beautiful journal which is available on the website. So all these programs are conducted free from the Brahma Kumaris. We have a team. So we talk about the basically the sessions to take care of the pregnancy, the labor, birth, because we are focusing on the increasing the normal delivery, decreasing the cesarean rate, and the positive parenting. The post delivery sessions are also conducted. So this is the model which we follow, and as we have to create the better personality, shaping the child's personality, the time is now when the baby is in the womb itself. And this is the module which we have created. It is a 1 month module, 28 day sessions weekly. There are different themes. So this is there in the journal. You can download it from the website. So to improve the baby's physical quotient, emotional quotient, then the mental, the spiritual quotient. These are the various different sessions we conduct. We conduct the sessions even post delivery, because we are focusing on the first 1,000 days of life. And these programs are done in collaboration with the organization. These are the scientific organization. You must have heard about the FOXY, that is the National Organization of the Gynecologists, Federation of the Obstetrics and Gynecology Society of India. Even when this was launched as an international webinar, you can see Sister Shivani also talking to all the presidents from the organization. And the journey so far, we are doing this for almost 13 years, and we have conducted more than 1,500 offline programs. The gynecologists benefited more than 3,000. These families benefited, expectant mothers more than 1,55,000. We conduct session even for the Asha Anganwadi Sevika, because we have to take to the grassroots level, and everywhere we cannot have the trained gynecologists. So we have online community, almost 50,000. You can check on the YouTube, that is Divine Garbhsanskar YouTube channel. And every month we are conducting almost 45 sessions. So this is the journey so far. In fact, this session was addressed and graced by the President of India right now, Honorable Mrs. Draupadi Murmuji, in 2018 when she was the governor. You can see this was the session was graced by even Dr. J.P. Naddaji when he was that time Union Health Minister. Then Mr. Shripad Naik ji, who was that time Ayush Minister. And then we have conducted many sessions even at ORC. You can see the Commissioner from the Maternal Child Health Delhi has addressed the program. And recently, after the COVID, the lockdown was over, 2nd March, we launched this session of Divine in India, wherein you can see the Union Health Minister, Dr. Bharti Pawar, addressing on for this project. And this is from my own hospital. As I said, I have a 50-bedded hospital. The entire third floor I have converted into the meditation hall, wherein we teach the expectant mothers, family member, the Asha Anganwadika Sevikas, and then the nurses. The sessions are conducted free. These are the sessions which are conducted in collaboration with the gynecologists. We train the gynecologists at our centers because the Brahma Kumaris has at many places residential centers, retreat centers. So these programs are done free at these places. And these are the sessions we take for the expectant mothers as well as the family members. So this is what I was talking about, the Super Mom Baby Journal, your Sati towards the journey of Super Mom. So these are the few of the pics from those sessions, and the awards received for the particular project, from the local organization, from the Foxy Figo Appreciation Award, the Foxy Wonder Foxy Award, Foxy President Appreciation Award, award from the Maharashtra Health Minister, Commissioner, and Mayor. So the way forward, I feel, is we need to empower our medical professionals themselves mentally, because they are burned out maybe. And so they themselves, our healers should heal themselves first. And second is considering the poor doctor-patient relation, the ratio in India. We need to collaborate with the organizations which promote and helps to promote the mental health. Like Brahma Kumaris, we have almost 10,000 centers across India, and we can do all these sessions free of cost. So we'll be able to reduce the burden on the health infrastructure as well, because we don't have those, the medical and the paramedical staff that much. So we need to take, collaborate, maybe the public-private partnership or the organizations like Brahma Kumaris, and maybe we can create an app, wherein we can have this in the vernacular language, which can reach to the grassroots level. Maybe government can help us in this, or the C20 team can help. And maybe we can create a certificate course or PGDM courses to create more Garbhsanskar experts. So this is what I feel the way forward. So let's empower the seed for a the fruitful tree for tomorrow. So thank you. So it's a happy woman will have a happy family, and not only the happy family, it's the happy world. And it starts from the woman herself. Thank you so much for patiently.